What's a mistake a doctor made that left you dealing with the consequences for the rest of your life? When I was in labor with my daughter, her heart rate would plummet with every contraction. Every time we questioned it, the nurse would tell us that it was just the monitor slipping. I went in at midnight, had a long labor, and was not examined by a doctor until an hour before she was born, around 2:30 p.m. the next day. By that time, she was in the birth canal and could not be delivered via C-section. She had the cord around her neck and was born blue and not breathing. They revived her and she seemed to be okay. It was months later, when she wasn't hitting the normal milestones, that we realized something was wrong. She has cerebral palsy and is intellectually disabled. She uses a wheelchair and has to wear diapers. She will be 29 next month and she still lives at home. We have to care for her every need. I love her unconditionally, but I always wonder, if that nurse had only paid attention and gotten a doctor there on time, how different our lives would be. I had a tumor in my colon. Over time, it grew and grew and grew, and I suffered multiple symptoms because of it. My doctor decided that my symptoms were PMS-related problems, even as they escalated. He told me to take Midol and get over myself, that women either deal with their issues and get on with life, or lie around whining and wasting people's time. Eventually, the tumor caused a complete bowel obstruction, and my body started to rot from the inside out. I can't even describe how painful that is. Anyway, I ended up in the ER. I was sent for immediate emergency surgery, ended up having part of my colon and necrotic tissue removed, and now have to live with a colostomy bag. I went from being a very happy, physically fit, and active person to whatever the hell shell of a person I am now. I use the VA clinic for all my health care. As a woman, when you get a pap smear, the line they always tell you is, "We'll call you if we find something." I left and never received a call, so I thought all was well. 2 years later, I changed doctors, and the next pap I got came back abnormal. I went to patient records to get copies of my previous pap, only to be told that they don't have them. Apparently, the lab where they sent my previous pap sent the results back, but no one had ever opened them, so they weren't recorded. When I finally got the records back, the previous pap came back abnormal. I ended up with stage 1 cervical cancer and had to have a hysterectomy. Now I can't have kids, but the claim for damages ended up paying for a house and paid off my student loans. My doctor ignored my very vocal concerns about the pains and strange symptoms I was having during my twin pregnancy. She missed all the classic signs of twin-to-twin transfusion syndrome, many of which I brought up to her. This led to me not having the treatment in time to save them. I remember having to decide whether I should bury or cremate my twins. Those were the darkest days of my life. Not me, but a coworker. She's admittedly overweight, probably over 300 pounds. About 2 years ago, she suddenly started losing a lot of weight out of nowhere, like nearly 50 pounds in 2 months. She hadn't changed her diet or anything else about her lifestyle. You don't have to be a medical professional to know that sudden dramatic weight loss without any lifestyle changes is a sign of a medical issue. So she went to her doctor. Her doctor didn't see the problem. After all, she was fat, and losing weight when you're fat is good. Wasn't she happy to be losing weight? He paid zero attention to the context of the weight loss. His entire thought process was, fat person is now less fat, so this can only be a good thing. Thankfully, my coworker is a very stubborn person and immediately went looking for another doctor. She was able to find one taking on new patients on short notice. That doctor actually listened, agreed that her weight loss was concerning, and ordered a bunch of tests. Turned out my coworker's weight loss, which her first doctor insisted could only be a good thing, was the result of intestinal cancer. She's doing pretty well now, after surgery and chemo, but if she'd taken that first doctor at his word, she most likely would have died. It was multiple doctors who made a mistake. When I was a child, I had recurrent UTIs. They never did any tests and just gave me antibiotics. They ended up having to remove the left kidney. I kept having recurrent UTIs even after having my kidney removed, and the doctors who operated on me kept denying anything was wrong. It was 3 years later when finally a doctor saw one of my exam results and diagnosed that I had urinary reflux. Basically, the urine was coming back to the kidney. He operated on me, and I never had any more problems. But by then, I was left with one kidney with decreased function and a serious mistrust of doctors. I was prescribed tretinoin for my cystic acne. The only instruction I was told was not to put it near my eyes. My dermatologist literally spent about 2 minutes with me after I waited for over an hour to see him. He didn't explain anything about building up the frequency of use or the sandwich method, and this was before tretinoin was super trendy online and there was lots of info. I wasn't told how drying or harsh it would be, and I was put on a high percentage right away because my skin was so bad. I did not put it near my eyes, but I noticed gradual and increasing eye pain and dryness. It got to the point where I would sit on my couch and sob because my eyes hurt so much. I told my derm about it the next time I saw him, and he told me it's completely fine and to keep sticking with it because my acne was still so bad. So I stuck with tretinoin for 9 months. Throughout this time, I saw 3 ophthalmologists. And finally, the third ophthalmologist told me tretinoin was destroying my tear glands and to stop using it. I stopped, but my eyes never recovered. I have to use very expensive prescription eye drops and a nasal spray that stimulates tear production for the rest of my life. Even then, my eyes are still dry and still hurt. I'll regret using tretinoin for the rest of my life. The worst part is, it did very little for my acne. It totally destroyed my skin barrier. Ultimately, birth control fixed my cystic acne. My surgeon left me on the table under anesthesia for 12 hours so he could work on another patient. I woke up with permanent vision loss in both eyes. He never even spoke to me after the surgery. He ruined my life. I'm not allowed to drive, and my prospects of furthering my career have vanished. I have daily panic attacks because I'm so disoriented all the time. When I asked why this happened, I was told it was due to surgical anxiety, so it's my fault. A surgeon nicked my ulnar nerve in my right dominant arm while removing a bone spur. At first, my arm and hand were numb and paralyzed. When I eventually regained feeling and movement, I was left with intense burning neuropathic pain. 15 years and 7 surgeries later, including 5 for replacing a spinal cord stimulator, the pain still persists and interrupts my daily and professional life. I'll never be the academic I had hoped I'd become. My mom had a stomach ache for a year. Her doctor told her to lose weight, go gluten-free, drink less, and eat less sugar, as she was pre-diabetic. By the time she collapsed and they finally scanned her abdomen, the cancer had eaten her pancreas and was working on her liver. We got 17 more days with her. Most of my pregnancy was absolutely mishandled. I am obese, so when I was losing weight from vomiting constantly, this was celebrated. I wasn't offered medication until I'd been in the ER a second time for dehydration. I now have panic attacks when I feel nauseous. At 31 weeks, I got reprimanded for gaining a lot of weight quickly, like 15 pounds in 9 days. I was swollen to hell. I started having breathing issues and pain in my abdomen. At 33 weeks, I couldn't think straight and went to L&D to find out that I had severe preeclampsia that should have been caught at my appointment a few days before. The OB was livid. I had immediate induction, which ultimately ended in an emergency C-section. The anesthesiologist also decided I was a drug seeker because my anxious self was cracking jokes to distract myself. So when I said I could feel a lot of pain partway through my C-section, he didn't believe me, and I ended up going into shock repeatedly from pain. Now I have PTSD, and my baby has developmental delays that could have been avoided had I been properly medicated. I am basically expected to develop full-blown heart disease no matter what I do in the next 10 years or so, and a huge medical bill for all of the specialists. If you enjoy this video, please give it a like and subscribe to my channel. Thank you. When I was 13, I started having violent tachycardia and hyperventilation. I had horrendous nausea. I couldn't sleep, and I was roasting all the time. It kept happening in school, and they decided that I was becoming a troublemaker and needed therapy. I've always been the teacher's pet and a gifted student who never had detention a day in her life. They told my mother to lock me outside the house to force me to get on the school bus. One day I genuinely thought my chest will burst open, so I begged my mother to help me. She still drove me to school, and they told her I should be admitted to a pediatric inpatient mental facility. They stuck me there for a month while I kept shaking, vomiting, and feeling like I was going to die. The doctor at the facility dismissed me as being overly anxious and attention-seeking. Nothing changed when I got out after a month. I don't remember what triggered it, but I eventually got someone to take my pulse, and it was over 200 BPM. They took me to the emergency room, tested me for drugs and all sorts of stuff, and the attending came in and took one look at me and said to my mother, Has her thyroid ever been checked? She said no. Why would they test me when I was just seeking attention? Turns out I had severe hyperthyroidism, the highest numbers that doctor had ever seen in a person under 21. She came back and told us, I have first-year medical students who could have diagnosed this on day one. I was so overloaded with hormones that my body physically could not eat or sleep, and it sent my heart into unimaginable rates of tachycardia. I had to be put on adult levels of beta blockers to get my heart rate under control. I had actual damage from it being forced into that kind of beating for so long. I lost the ability to regulate it. They tried for 2 years to control my thyroid with medication. I was on the highest possible doses, but it was barely doing anything. When I was 15, I had to take a massive dose of radioactive iodine to act as a lethal injection for my thyroid because they simply could not control it. And let me tell you, having to feel and go through one of your organs dying sucks. It sucks so much. I was cold, fatigued, bloated, nauseous, and sore-necked for 6 months until they tested my blood. And it didn't work. It didn't work. I had turned into a shadow of myself who was homeschooled and could barely leave the house, and I had to do it all over again. If a second dose didn't work, I was going to have a thyroidectomy. The second dose was worse, but it finally worked. I turned 40 this year. I still deal with tachycardia. My pulse can flare up and go off like you wouldn't believe. It's very hard for my body to regulate. My thyroid issues left me with infertility, anxiety, and a lot of rage toward my family and the medical community. A doctor told me the lumps on my cervix were just scar tissue, and he would contact me if the pap smear was abnormal. He never did, so I assumed everything was normal. 2 years later, I was diagnosed with cervical cancer, and instead of having a rather simple cone biopsy to have part of my cervix removed, I had to have chemo and radiation, which put me into menopause in my early 30s. I was born with no irises. When I had cataract surgery, I had some rings implanted as fake irises. Although they don't close or open, they would limit some of the light entering the eye. Unfortunately, the rings were not lined properly, and I now have triple vision within my 1 and 2 o'clock area in my circle of vision. I noticed it as soon as I woke up after surgery, but I was told they would eventually settle. Apparently, my eyes are too fragile, and it is too risky to try to fix them. It made a significant change with things that I could do, and I've lost much work because of it. When I was 27, I had a tumor surrounding my pituitary that I had removed. During the surgery, the surgeon messed up the organ somehow and gave me diabetes insipidus for the rest of my life. It means my body can no longer regulate the hormone controlling when I have to go pee and will just suck all the water from my body, making me have to pee all the time. It used to be really severe, and I was chained to medicine that had to be refrigerated and taken every 12 hours. It's gotten better, and now I only have to take pills, but it's still every 12 hours or I'll eventually dehydrate and die. I had an ongoing dull pain in my chest and back that eventually motivated me to go see a doctor. He told me I was sleeping wrong and gave me muscle relaxers. The pain lingered anyway. 2 weeks later, the pain had grown so intense that I eventually went to the ER. Turns out I have a thoracic aortic aneurysm and finally got some morphine administered. I've never felt so good. I can see why people get addicted to opiates. Soon, I had surgery for stent placement in my artery. During the surgery, I had 14 embolic strokes. I wake up from the surgery and realize I can't use my hands with any articulation. I ended up doing 5 months of neurotherapy just to learn how to walk smoothly and be able to actually open a bottle of water. The original mistaken doctor didn't cause the aneurysm, but he certainly didn't listen or investigate to a reasonable extent. I used to be great at typing. Typing this here took me 15 minutes. My job prospects have diminished quite a lot. I had a small routine surgery where they used spinal anesthesia. They pierced my dura and caused my cerebrospinal fluid to leak from the hole, causing my brain to sag down inside the skull. I now have constant headaches, brain fog, facial pain, memory issues, balance issues, and heart issues. I lost my ability to study, work, and even live. I was misdiagnosed back then. I finally had a correct diagnosis just 3 months ago, 14 years later. They don't know if it's treatable now as it's become chronic. It would have just been a 30-minute outpatient procedure if they had correctly diagnosed me back then. My OB/GYN said I was touching my boobs too much, and that's why I was lactating when I had never been pregnant before. It took 2 years and a nurse to figure out I had a brain tumor that I will now have to take meds for the rest of my life. I got told I was imagining all the pain I still had after my gallbladder was taken out due to gallstones. My doctors dicked around and treated me like a drug seeker when I was in constant pain. I emergency married my fiance months before our wedding so he could take me to the VA hospital. Within a week, the VA doctors figured out that I had gallstones trapped in my bile duct and stage 2 pancreatic cancer. I had surgery right away and beat the cancer. If I had stayed with my original doctors, I would have died. Doctors put me on an antidepressant as a child. They never investigated or suggested therapy. My home life was bad, but I didn't need a pill. I needed support and a better home life. I have since spent most of my life dealing with the side effects and withdrawal of trying to come off of them. Ironically, doctors continued to deny the reality of side effects and withdrawal being life-ruining. By the way, the drug I was put on was later sued into oblivion for lying in safety trials for children. But doctors didn't believe me when I said it made me suicidal, just like the lawsuit revealed. The first doctor who prescribed it, and every subsequent doctor after, have caused a domino effect of life-altering consequences for my health. Not sure if they'd admit to the mistake, though. Obvious disclaimer before anyone jumps in to misinterpret. Yes, antidepressants can be helpful for some. Yes, they can save lives. Yes, some people have no issues with them. This isn't about you. This is about those who were harmed by them and then gaslit by using those who were helped as justification. Two things can be true. These drugs help and these drugs kill. It's a sobering tension to hold. I had a very deep nose infection created by an untreated cold I had one summer. The doctor was giving me ibuprofen and nose spray, but the humidity was worsening the infection I had in my sinuses. You could only see it with an internal camera. 3 different doctors said I had nothing and that I should just blow my nose. 9 months after I got the cold, I fainted because of the infection, and in the ER, they told me I needed surgery. I had chronic sinusitis. That was 2021. As a side effect of the surgery, I have a severe allergy, and of course, the chronic disease is not gone because it is for life. I had to have my spleen removed following a car accident. The doctor stitched through my intestines, leading to a terrible infection. I almost died from the infection, and they had to open me back up to remove gallons of liquid shit from my stomach cavity. They left the wound open to heal, and I had to stand in the shower at the hospital and push my stomach from both sides to try to squeeze all of it out. I still have a gnarly scar and a massive hernia from it to this day. My 5-month-old son had constant watery eyes and runny nose. He cried nonstop like he was miserable. I took him back to the doctor 3 times. The first time he said it was just a cold and gave him Tylenol for discomfort. The second time he said it was probably allergies and suggested child allergy meds. The third time he was like, "Look, kids get runny noses all the time. It's common." A month later, I took my baby to a clinic for shots, and the doctor there said right away that my son had glaucoma and needed eye surgery to relieve the pressure. 2 surgeries later, and my son is now 1,000 times better. But for all those months, the meds that the idiot doctor told me to give my child were actually making his symptoms and pain worse, and it makes me so sad to know how my baby suffered. It started with a very loud ringing in my ear, then violent bouts of vertigo. I went to my primary care provider because I was pretty sure I'd lost hearing in that ear. I will never forget the doctor telling me, 28-year-old women don't go deaf in one ear. You're imagining things. He said he could make a referral to a neurologist, but it would take 3 to 6 months. So I paid out of pocket to go to an ENT, who immediately ordered a CT scan. Thankfully, it wasn't a brain tumor, but nerve deafness, which could have been prevented by steroids. Another kick in the pants was when my insurance didn't cover the CT scan. They told me, if you'd had a brain tumor, it would have been covered, but aren't you glad you don't? I lost my mom when she was just 57 years old. I was 21. It was January 2009. She had a 3-day history of severe abdominal pain, so severe that she was literally lying on the GP waiting room floor, groaning in agony. She was seen by the doctor, told it was indigestion, and sent away with a bottle of Gaviscon. 2 days later, with worsening pain, my mom called an ambulance for herself and went to the ER only to be sent home again. The next day, Unable to cope any longer, she took herself back to the ER. This time, they reluctantly admitted her. 12 hours later, she was transferred to ICU and immediately intubated. She was diagnosed with sepsis secondary to necrotizing pancreatitis and had developed multi-organ failure. She spent 14 days in ICU while her insides perforated and infection ravaged her body before passing away one Sunday morning. 16 years later, I still carry so much anger. Anger that my mom's pain was dismissed, that she wasn't taken seriously, that her schizophrenia led doctors to overlook her suffering. Anger that I never complained, that I never got justice, and that those who ignored her pleas were never held accountable. I was completely numb after she died and poured all my energy into finishing my nursing degree, but I carry so much regret for not finding the strength to stand up for her. Because of my mom's severe mental illness, I was taken into care by social services when I was 6. She endured years of involuntary commitment and police interventions. She fought so hard to get back the little girl she had longed for. And just a couple of years after we had finally rebuilt a beautiful relationship, when she had stability with her children, and her schizophrenia was relatively stable for the first time in 25 years, she was cruelly taken away in the most painful way imaginable. Thank you for watching, and don't forget to like and subscribe to my channel for more Reddit stories. See you in the next video!